welcome to another episode of our Be Informed podcast, a space where young people come to learn and have honest conversations about health without stigma or judgment. I'm your host, Elizabeth James Sahabu, and today in our studio we have a special guest who will introduce himself. Welcome.
My name is Joseph Robert Linda. I come from Uganda. A pleasure to be hosted on this podcast.
You're welcome. So today our topic is mental health and young people and why we don't really talk about mental health as young people. So jumping straight to our first question, Mr. Joseph, why young people struggle to talk about mental health issues?
First and foremost, young people struggle to talk about their mental health issues they are facing due to factors within the community where we stay. A lot of communities have stigmatized or normalized the idea of people speaking about what they are currently going through. When you come out to speak, especially if you are a young person, they feel like you are weak, you should be groomed to harden in the situation. You will see your parents telling you, during our time, we were able to handle that, which is different to them because our state of mind may not be able to handle some of the challenges you and the other person faced, and we tend to cope up with our challenges in another way. So most young people have failed to open up because whenever they tried that, their parents tend to feel like these young people are weak. But away from that, only the cost of accessing mental health services in our health setting today as young people, it is quite inaccessible. Where it is expensive, and to some people who cannot afford and to those who do not know where to find them, it becomes a challenge to locate what is a health facility that I can go specifically for mental health. But also away from that, we look at the stigmatization it comes with. From my country, Uganda, when you go to a mental health facility, they have a tendency of thinking whoever goes to a mental health clinic is a mad person. Yeah. So that alone has kept away young people from accessing this health service at an early stage, but also hindering them from seeking the necessary support which can overcome the future challenges in line with their mental health. And currently, I will say that in our communities, there are a limited number of peer support groups that typically socialize with us to address the challenges we are facing, not just to address, but also to share and cope up with whatsoever we are facing. When you compare to the past years of our parents, of our grandparents, they had time as a community to socialize, to share and learn from one another. But today, if a young person is not at school, they are at work. If they are not at work, they are doing something else. This has left them with minimum time to cope up and associate with other people where they can share and get the capacity to cope up and be supported in these community groups.
Before asking you the second question, I don't know the case in Uganda, but we have cases here, like you see, young people commit suicide, young people start using drugs and some other bad behavior. So maybe from those experiences, if you also have similar experiences in Uganda, maybe you can tell us what are the common signs that shows somebody is not okay, like the early sign that we as community members, we can just identify this person, probably he's having mental health issues and he needs support.
The key points to look at for caretakers, guardians, or parents out there for your kids. Some kids respond to their bad mental health in a way of withdrawal from their desires. You see this young boy who used to prefer going to play football, he's no longer going to play football. He just goes to his bedroom to sleep. But away from that, some withdraw from their existing peer groups of friends that they have, simply because, as I told you, they do not feel safe to share what they are going through. So what they tend to cope up with is withdraw from that group, staying alone, while some even tend to go on and start doing drugs. They go into alcohol at an early age or young age, which later drowns them. But we have also seen rare cases where some children or young people end up committing suicide, especially those at universities, because university is one of the most challenging stages of life for these young people, because they are transitioning from being young people to adults. It is like they are bridging age, so it becomes really hard for them to cope up with whatsoever they are facing in life, and some of them end up committing suicide.
Okay, so maybe the last question from my end will be, now as community, as young people, as family, parents and friends, how can we create safe spaces for honest conversations and support?
First and foremost, I'll begin with communities to ensure that the guardians, the parents, and we, the friends and family, we ensure that we have honest conversation or open spaces which are non-judgmental. The saying today, people say is we listen, we don't judge, but people end up judging. So you should be able to listen to your kids, to your friends and relatives, advise them without the fact that you are going to judge whatsoever they are facing. You'll be like, oh, Joseph, you are a young boy to be going through this. You are a young person to be facing this. No, all they need is your guidance, and address them or link them to where they can get better services. But also it goes back to our key stakeholders from government, from the community, to ensure that we have better policies in line with integrating mental health services with other health services that we are seeking. In that, when I come into a health facility for my medical checkup, if I'm here for malaria or what I say, I am able to be screened for mental health, such that they are able to detect what I may be facing, because sometimes bad mental health, some people do not know that they are facing. They are into a phase of bad mental health. So these routine screenings, these routine checkups, when they are integrated into the medical or health facility settings, they tend to help us identify whatsoever young people or the rest of the people are facing within the community. But also, away from that, we need to look at funding to ensure that these integration things and capacitating of the health workers who are addressing mental health are available. Because if you look, I know if you will look at the ratio of the psychiatrists who are supposed to be doing the examination of the young people, but also the counselors who are supposed to be professionally counseling the young people at the health facilities, you may find the numbers are really, really minimum. So funding has to be put in place such that the government is able to keep this running, but also to ensure that young people have a right to mental health services.
How is the situation in Uganda when it comes to accessing mental health services?
I would say it is quite similar, but fortunately we have some organizations which have taken up a step into ensuring young people's health are integrated. So they have established health youth corners in most of the facilities that are government owned, that when this young person comes, they will be able to get mental health screening at the youth corner, because there is a youth counselor who is trained to handle and also screen their mental health condition on that particular day that they come, because mental health differs. If I come in May, what I'm feeling in may be different when I return in July. So they have ensured that the health workers who are their fellow peer supporters that are capacitated are always around to do the assessments. They are always around to listen to their stories. But also with creating peer support groups, whereby some of these groups, some of them, for those who are not into school, they meet over the weekend at given meetup points in the community to speak to one another, to share with one another, other than leaving these people in the community where they will not talk to anyone and end up opting for drugs. These young people come to the health facility over the weekend or in a specific day of the week to speak, to share, to learn from one another, but also to ensure that they seek the right advice of how they can cope up with whatever they are facing in life.
You spoke as if you guys are doing well in Uganda. Does that mean all is well?
Actually, the situation remains similar, not just for Uganda, but around the globe. When you look at the mental health statistics, that globally mental health has been abandoned. This is still the case for my country. While I may speak about the existing youth corners, the existing peer support groups, this is just a drop in the ocean for what needs to be done throughout the country. When you travel out of the city or out of the urban areas, you discover that even in the rural areas, young people have no access to mental health services, have no access to the peer support groups that they should be belonging to, but also the support from their relatives and guardians. So it remains a challenge that these people still in my country do not have areas where they can go for support. They do not have guidance on what they can do to cope up with whatever situations they are facing. This calls for a continued action. Big ups to WeCare for ensuring that they are bringing us such discussions to the community to understand, but also to sensitize key stakeholders to come up with better policies that uplift not only mental health, but the well-being of young people.
Thank you. Thank you for a good conversation. We have reached the end of our podcast today. And just to conclude, what I can say is mental health is not a luxury. Mental health is part of our everyday life. And the more we talk about it, the more we create a safe spaces for other people to open up and also talk about it. So that's the end of our podcast today. Until next time, don't forget to subscribe to our YouTube channel, but also follow us on our social media platforms at wecareinitiative.or. Until next time, bye.